Now, I tell you what, here is an absolutely fascinating issue. I don't know whether to be worried by it or reassured by it or whatever. And you can think of, watch this. Medical staff working in accident and emergency departments in hospitals in Oxford will start to wear body cameras this week. It's part of what's going to be a 3-month trial to help deter hospital visitors from being aggressive.
Well, let's talk to our South East reporter who's outside the John Radcliffe Hospital in Oxford for us this morning, Ellie Costello. Morning, Ellie.
Hello.
I mean, this actually causes a lot of concerns, doesn't it? The idea that clearly a lot of patients going to A&E are getting aggressive.
Good morning, Anne and Stephen. Yes, it is very concerning, isn't it? There's obviously a need for this campaign. It's called There's No Excuse. It's this wider campaign that's going to be running for 3 months to essentially remind the public that there is no excuse for being violent, for being threatening towards A&E staff. So it's going to be happening at the John Radcliffe Hospital, which I'm outside now in Oxford, and their frontline A&E staff are going to be wearing body cameras on the front of their uniform for the next 3 months. It's starting this week, and these cameras are very small. They're about the size of an iPhone camera, and they won't be switched on all the time. They will only be switched on when an individual starts to become aggressive or violent, and that person will be informed that they are being filmed. So the idea is that this will deter people from becoming violent to staff, and in the worst case scenario, it might help to build evidence in a police investigation if it does indeed get that far. But as you say, it does raise concerns about why this is needed. So I spoke to Katy Mimpress, who is the matron of the A&E department here, and I asked her why this campaign had to come into force.
Become pretty much a daily occurrence, and it can be day and night. We've seen a sharp rise in the level of cases of verbal abuse, and thanks to the dedication of our staff in reporting this, we're able to really see that actually from November last year, in comparison to the November the year before, in 2020, we've more than doubled the incidences of cases of verbal abuse, unfortunately. I think it's a combination of a lot of things, unfortunately. It is multifactorial. Naturally, the pandemic is playing a part in things, and within the emergency department, we don't allow visitors unless it's exceptional circumstances, such as a registered carer or naturally a parent with a child. And people understandably want to accompany their loved ones, and a lot of this is born out of frustration in that they can't. And that's because we're trying to maintain social distancing, we're trying to protect our patients and our staff. So we will just follow national guidelines and trust guidelines and ask for no visitors. And that causes at times a lot of unhappiness, and that can escalate into verbal abuse. There's also times when we experience longer waiting times than we would like. And equally, again, that causes frustrations amongst patients and sometimes the people that are with them. And again, that can turn to verbal abuse.
That's Katy Mimpress here. She is the matron of the Accident and Emergency Department at the John Radcliffe Hospital. And she actually gave me some figures for this situation at the moment. She said that verbal aggression and physical violence had increased by 125% in the past year. So in November 2020, there were 80 reported incidents of violence and aggression, which I actually already think sounds quite high. But in November 2021, this had doubled to 190. So clearly this is a big problem here, but it's not just happening in Oxford. This is a problem that we are seeing nationwide, especially as families aren't able to go in with their sick family members when they enter an accident and emergency department. And Katy told me that she hopes that other trusts will lead by their example and help to try and keep their staff safe. And of course, drive home the message that there is no excuse for violence towards NHS staff.
OK, Ellie Costello, thank you. I find it absolutely stunning that people would go into that sort of situation and be rude, never mind aggressive.
You feel like saying, what has the world come to when we've got to give our nurses and doctors body cams?
I mean, they're people who are there to help us.
Yeah, but it is a huge problem for them, apparently. Really nasty aggression.
If you're a nurse
Maybe
this morning, if you're an A&E nurse or doctor, get in touch. Love to hear your thoughts on that this morning. GBnews@gbnews.uk.